Hello, welcome to this presentation from the American Academy of Grief Counseling and AIHCP on grief and loss. My name is Mark Moran. I have a master's from John Carroll in theology. I also have a master's in counseling human services from Regent University. This presentation is very comprehensive, but also very concise. It doesn't mean to capture everything you need to know about grief, but it's going to touch on a lot of the aspects of grief theory. It's divided into four categories. We're going to discuss what is grief in itself in part one. Part two is going to look at the various stage theories on grief. Part three will look at the types of grief. Part four will look at the various cultural, gender-based, spiritual effects that those things have on grief itself. And finally, part five, we're going to look at how to help those who are grieving, some ways for helping professions in human services to better help the grieving. So this, in essence, is a psychoeducation presentation for those who are grieving, but also for a number of individuals in human service who are looking to potentially learn more about grief and maybe even eventually earn a grief counseling certification within itself. I'm going to remove myself from this image as we go through the presentation. There we go. And let us begin with part one. What is grief? And we are going to take a look here at the many manifestations of how grief affects an individual. Ultimately, grief is the price of love. Bereavement is the fact of loss and the change of status of that particular person due to the loss. And this is what we refer to as the bereavement process. Grief is a response to that bereavement and the feelings that are associated with bereavement and all the changes that take place. Mourning is actually the cultural expression of the bereaved person's thoughts and their expressions. So those are three terms that I think that are kind of interconnected and interused by professionals sometimes, as well as just lay individuals, bereavement, grief, and mourning, but they all have their own definition and play a different role in the actual grieving process. Bereavement is the process, grief is the response, and mourning is the actual expression. So grief is the product of loss. The greater the attachment, the love or connection, then the greater the loss reaction will be. So if you are attached to someone very closely, a parent or a child, or even a pet, the stronger that bond is, when that bond is broken, the greater the reaction to that. And that's why we say grief is the price of love itself. So it's more than just a person or a pet. It can be any type of relationship. You can experience loss in regards to your career, your self-image, maybe an ability you once possessed, a dream, or maybe an unaccomplished life goal, or even one's own youth or one's lack of health. So the human mind naturally wants to avoid these types of losses. Who wouldn't? Everyone wants to avoid bad things, but bad things are part of life. And that's why it's important, extremely important, to understand what grief is, to better be able to cope with grief, and to walk along as a pilgrim on this life journey in a fallen world where loss and sadness occurs. Unfortunately, grief is the price of love. Now, there are severe losses to consider. Not all losses, as I mentioned, are just a loved one or a particular individual, but they can play roles beyond just a loss of a person. Loss of self, which is loss of self-image or desire, career, health, a body part, mental and physical abilities that once were overlooked, but one no longer possesses. There can also be losses due to crisis and trauma, losses due to natural disaster of home, family, and placement, as well as being a victim to a crime or losing a family member to suicide. Now, in considering this, when we go back to what we consider the most common type of loss that we talk about, loss of person, some of the more severe in regards to that would be the loss of a child. And this is probably considered the most intense loss a person can ever experience. Many parents who experience a loss of a child are never the same again. And that's probably true of 99.9%. They have no ability to cope through it, and some unfortunately are lost to suicide or maladaptive coping through various drugs and other substances that derail their life forever. Others are able to come through and are able to adjust to the loss, but they're never the same. There's always a piece missing in this type of person. Now, this is not to dismiss the loss of a parent, a sibling, or a spouse. Obviously, any losses of family members are severe, and this is why even workplaces recognize that time off is needed in these types of losses. Obviously, a loss of a parent is something that we all eventually face, but what about individuals who lose their parent when they are very young or in the prime of their life? This can have a more severe effect on their development. Losing a sibling can also impair an individual's ability to go forward in life. Always thinking about their best friend, if it was a close relationship, and what would have been said or done at a particular event. Spouse, losing one's spouse can be an extremely difficult thing as well, especially for those who have lived with the same individual, shared life with that individual for over 50 years. Those individuals sometimes are in their older age and they cannot function anymore without their beloved spouse, and it becomes difficult. So, severe losses to consider obviously are not just, as I mentioned, start with individuals. They can be loss of self, anything due to crisis and trauma. But when we look at losses of individuals in life, obviously, the greater the attachment, and sometimes the greater the relation, the severity of the loss can affect us longer over time. Now, I think it's important also that we differentiate between depression and grief. These are two other terms that are interlocked and used in lay terms all the time. If someone is sad, they will be asked, "Are you depressed?" And obviously, depression is more than acute sadness or a response to a particular loss itself. So, depression is a diagnosed condition, it's a pathology, which can have a targeted loss. It can trigger depression, or it may have nothing to do with a particular loss at all, but may be due to an individual's genetic or environmental considerations, or even past traumas that can emerge. The major depressive disorder, according to DSM-5, has various symptoms that persist for up to 2 weeks. The disorder can include low moods, lack of interest in life, difficulty concentrating, sleep pattern changes, eating changes, fatigue and aches, hopelessness, and also suicidal ideation. Within the general major depressive disorder, there are also other types of depression that many individuals suffer with. Bipolar depression is one, which has a series of highs and lows, with low depression and then high states of mania throughout the year, as well as seasonal depression, which affects an individual during particular seasons. And it doesn't always have to be winter. Depression can manifest itself also under the disguise of high functioning, where the person is still able to go to work or school, but deep down they're very depressed and there is something wrong, especially being seen in how they interact with others or find joy in life itself. So when we look at grief, grief is a reaction. It's a reaction to a particular loss. And that's one of the biggest differences from depression in it. It's not a disorder, it is natural. It is focused on the loss, and the intensity of the loss should fade over time. However, grief can become pathological, which we will discover. When it does not fade over time, complications can occur, which cause what we refer to as a prolonged grief disorder, which can also emerge in other forms of complicated grief. However, major depressive disorder or bipolar disorder do not fall under the normal trajectories of grief itself. They can be tied to complications in grieving, but they themselves are disorders that usually are not associated with any particular focused loss. Instead, for many, depression is a result of imbalances within neurotransmitters such as serotonin or norepinephrine, and they require certain medications such as SSRIs to help find that balance again. So I think it's important for those who are studying grief and trying to understand it to truly comprehend the difference between depression and grief itself. Now, grief itself manifests in a variety of ways, affecting the entirety of the human person. Physical sensations, such as hollowness in one's stomach, tightness in chest, shortness of breath, loss of coordination or balance, various weakness and lack of energy, are all physical manifestations that can occur upon the immediate acknowledgement of bad news, of something that something bad has happened. It can also occur throughout the grieving process when one is simply alone thinking about the loss. This can cause intense physical reactions to what one is feeling inside. And that brings us to the affective and emotional state of an individual. One may feel extreme sadness, guilt, anger, anxiety, loneliness, shock, yearning, numbness, and for some, even relief. Now, a lot of these emotions will differ particular cases and particular individuals due to the fact that grief isn't the same for everyone, and different feelings are associated with different relationships. One thing to consider are grief outbursts. So even if it could be 3 to 4 months down the road, a year, there can be an outburst of emotion, which is completely healthy and not abnormal. Cognitively, when we refer to the functioning of the brain, many, while experiencing physical and emotional distress, also are trying to understand the loss, disbelief, confusion, preoccupation. Some even have a sense of presence of the deceased, dreams of the deceased. Many think they might be crazy and they might experience time distortion. Maybe a rethinking and retelling of the story becomes something that is a constant with whomever they see. And this is important in their cognitive recovery, to keep processing it through talking. Behaviorally, grief affects how we act because we're not feeling right inside. Lack of sleep or appetite is normal. Loss of interest in activities, or in other cases, an increase in activity. Individuals will try to blanket their remorse and their sadness through extra work to try to take their mind, to escape. This is why some avoid reminders, while others will cherish objects, which is fine. Others will enter sometimes into a state of hypervigilance trying to remember the loved one's face or the loved one's voice in particular. Socially and spiritually, interpersonal relationships can become strained. Loss of organization. Spiritually, a searching for a sense of meaning, which can lead to hostility towards, or in some cases, a need of a higher power, and to try to understand how that higher power plays a role in this intense sadness. And this can also be in cases of one changing one's worldview and not having an understanding of how one's paradigm of life, how it was all so right, and suddenly everything is all so wrong in itself. There are a variety of myths that also accompany grief. Obviously, the myth that grief is a pathology. Grief, in fact, is normal, as we've discussed. Freud's conclusion that grieving is a loss of equilibrium is not accurate. Freud taught that one's equilibrium is imbalanced, the emotional equilibrium, the cognitive equilibrium, and that imbalance due to loss is a pathology. What we've learned is it's actually a natural reaction. It's a readjustment. And it's a readjustment that remains with us forever. It's something that we don't let go of. It's something we learn to live with. That's healing. But there's never going to be the same before and after. And this is not pathological. This is healthy and normal. Another myth is that grief is orderly. While Elizabeth Kubler-Ross, who we will study later, teaches that grief has certain phases, it has somehow managed to unravel into an idea within the mindset of many that grief happens in orderly fashion. And this is not true. Grief is messy. It has no order, and it's different for every single individual. While stages within Elizabeth Kubler-Ross are seen, one can revert back and forth. This is something, again, that we're going to look at when we discuss stage theory. Another myth is that one must remain strong. Contrary, tears are not a sign of weakness, nor acknowledging the emotions of grief. In fact, it is essential in healing and adapting to the loss itself. Another type of machismo is to walk away from grief, not towards it. Grief work, on the contrary, is critical to adjusting to the loss. It is important to embrace grieving and to work through it to avoid future complications down the road. It's when one walks away from grief. It's when one denies the grief itself or the loss itself and tries to remove it that eventually trouble is going to emerge, because we all have to face the demons of loss eventually in itself. So there are 7 principles that are important in this story that we need to identify. Principle 1, there is no right way to grieve. If someone tries to tell you you should grieve this way, that's bullying in some extent. We refer to these in the industry as grief bullies. Principle 2, you cannot fix or cure grief. Grief is part of life. It's part of the human condition. It is the price of love, as we started. So you can't fix it, you can't cure it. And as counselors, social workers, those in the field of human service at a pastoral level or at a clinical level, you can't expect words or things to fix or cure a grieving client. We help the client live and grow around the grief, but we do not look to fix or cure it. Principle 3, there is no universal timetable for the grieving. Usually we look at a certain timetable of 6 months to a year, but what if someone goes over that? Well, I think we need to look and see how well that person is adjusting. But if they're still grieving, it doesn't necessarily mean it's a pathology. It's how they are adjusting and accepting the loss itself. Principle 4, every loss is a multiple loss. And this is shining upon the reality of secondary loss itself. When you lose someone or something, there's always going to be a chain reaction going down the line, a domino effect. If one loses a parent, well, what else did that parent do in your life? Those are secondary losses. Principle 5, change equals loss, which equals grief. And this is what grief is about. It's about adjusting to change, in particular, the change of loss itself. It's a natural reaction. Principle 6, we grieve old losses while we grieve the new ones. So if you lose a particular loved one, quite naturally, you're going to think about how you grieved past losses and how they are similar to what you are grieving now. Finally, principle 7, when when we grieve when a loss has occurred, we grieve when something is threatened. So, not just when a loss has occurred, but we grieve when a loss has occurred or it is also threatened. So there's an anticipatory type of element at play here, where it's just not just the actual occurrence, but also the possibility. And many of us have sometimes thought, oh my, what would I do if this particular person had something bad happen to them? I mean, I can't even envision it. And a lot of us with children just immediately throw that out because we don't want to even think about such an event. So there are three conditions of grief because it all goes back to the bond itself. So if the change between the individual and within the relationship of the bond is broken or altered, then this creates a grief reaction because that bond no longer exists. Whether that's a death that breaks the bond, maybe a divorce in a marriage, which alters the bond. These things all lead to a change within the relationship. A threat to the bond, and we just spoke about that. Whether it's an occurrence or a threat to that occurrence, it can evoke within us a grief reaction because just the thought brings us to that perilous end of the road, the precipice, where we look down and we see the cold reality of what if. And deep down, because we live in a fallen world, we know that what if is eventually going to come for us. And finally, the unestablished bond. What about individuals who seek a certain bond and it never developed? Maybe they have a bad relationship with their parents. Maybe they were never able to have children. So there's the I wish this would have been type grief that can occur for a non-existent bond, which would have been a good bond in one's particular life. So regardless of the bond, grief work is essential in repairing, in adjusting, in moving forward with the grief with us. So when we dismiss grief work, that complications later occur. And this first term was coined by Sigmund Freud. And Sigmund Freud taught that one must work through grief to finally adjust and adapt to the particular loss. If grief work was not accomplished, the person remained in dysfunction and unable to find happiness, according to Freud. Freud maintained, and this is where we differ in our modern ideas of grief work, but Freud maintained that one must sever the bond to find balance. And what we've seen in research of Klaas, Silverman, and Nickman is that we need to maintain these bonds, but here's the key, in a healthy way. We don't sever the bonds. They're not holding us back. They're not weights, but we need to maintain them, but maintain them in a healthy and conducive way. Now, for our purposes, the first studies, at least modern studies, not to say that grief hasn't been analyzed throughout the chronicles of history and through the words of poets, but for our purposes, the true beginnings of grief and crisis really began at the Coconut Grove fire in 1942 with Eric Linderman. He helped the survivors work through the loss, and he identified their various grief reactions as a result of this tragic fire. So it's important since then and forever, really, that we don't dismiss grief work, but we face grief. We don't want to sever the attachment or the bond, but we want to find adjustment and grow around our grief. Our grief's always going to have a certain size hole in our heart, but we can grow around it. We're not going to make it smaller, but we're going to grow bigger around it. For those who don't, there's going to be a myriad of various complications in themselves. So grief work then is a continual process. Grief just doesn't end at the funeral. It just doesn't end in a few weeks, even a year, but it's a continual life process. And this is why it's so sad at the funeral where individual loses their beloved, their friend, their parent or cousin or aunt or grandparent. All the words are said, all the little sayings, the hugs. And then after that, we tend to forget about those. And they are beginning their dark journey in those next few weeks, even a year, working through their grief, learning to grow around the grief. The funeral is only the first step in accepting this loss. So, throughout that time period of grief work, individuals will experience various grief triggers that are just as simple as a scent, driving by a location, or a memory that can really trigger an intense grief reaction that could even be a year or two later. Wolfert describes this as a grief burst. Imagine reopening an old cell phone you might have or looking through photos. These can be triggers. Holidays, birthdays, death dates, anniversaries. They all play a key role in our grieving process throughout life. And while these are sad dates, sometimes they can also become commemorating dates where we cry, but we also commemorate. We remember, we share, we laugh. So it's important that we continue bonds in a healthy way. And by continuing our bonds in a healthy way, we're able to work through grief itself. We're now going to start part 2 of this discussion. And what we are going to discuss in part 2 involves grief theories. And we're going to look at a variety of important grief theories that help not only the bereaved understand what they're going through, but also for those in the human service fields to better be able to help individuals through the grief process, through identification of some type of psychoeducation that can be given to the individual, and also as a guide for human service professionals to understand where a particular client is grieving. Overall, stage theory is one of the biggest ones at the forefront of grieving. It has been misused, unfortunately, quite a bit to think that grief is orderly. However, the work that Elizabeth Kubler-Ross did with the dying and those who had terminal illness is very important, and we will discuss that. We will also discuss attachment theory, John Bowlby, and the importance of forming healthy bonds. And this has a huge implication in a variety of later in life pathologies due to just forming healthy attachments with other individuals. Meaning making is another thing we'll cover by Robert Neymeyer, and it investigates the importance of finding meaning in loss and being able to integrate that in life. We'll also look at dual processing by Strobe and Schutt, who realized that individuals grieve on two fronts: the emotional front within, and then the adaptation to the new reality from without. So we're going to look at these types of grief theories. Stage theory begins, according to Kubler-Ross, with denial, followed by anger, bargaining, depression, and acceptance. Now, how these appear with a particular individual can differ greatly. There's no science behind someone's going to immediately deny it. We see it a lot, we witness it a lot, but it's not necessarily a given that this will occur in itself. Bear in mind, Kubler-Ross worked with the terminally ill. And in that process, she dealt with grieving individuals who were dying. So when you receive bad news about a medical condition, most often than not, you do deny it. Maybe family and friends deny it. So while these are not necessarily chronological, I think they do have a lot of value in understanding where someone is, or where someone can revert back and forth, or have something else as their first reaction. Somebody might respond first with intense anger in itself. So as we look at this, we want to understand within stage theory that grief isn't orderly, but it is fluid and oscillating. So oscillation illustrates how the stages are not always chronological. Grief comes in waves of intensity at different times. So when grief is acute or fresh, just like a wound, the waves come more frequently, the pain. The intensity of first cutting your hand, the pain waves. Same thing if we cut our soul. The waves of anguish come more intense and more frequent. As grief adjusts, the waves become less intense and less frequent, albeit they still can come and go whenever they are triggered. So if we can imagine a chart going up and down, and then how quick those peaks and valleys are, how frequent they are, we would say that that's a very acute description of one's emotion as it oscillates, whether it's denial, whether it's anger, whether it's sadness, whatever it might be. It's adjusting with frequent ups and downs, peaks and valleys. Now, as grief adjusts, there can still be some peaks and valleys, but they're less intense and they become less frequent. And there's more time in between the emotional outbursts themselves. And this is natural healing. Even so, many individuals ask, what about laughter? Laughter can fluctuate in between these emotions as well. And many sometimes feel guilt for experiencing maybe a joke or two about a deceased. Actually, finding humor and joy during grief is natural and healthy. Laughing is a powerful tool in the healing process. So we want to dismiss that right now. If anyone is experiencing some joy and finding humor in the past, or if they have a time in between their grieving to actually do something that's for themselves, watching a television program or going somewhere to a restaurant. This is important in healing. Overall, the function of sadness is key. It's an important part of grieving. It's an expression of our removal of the beloved through states of mourning. Sadness helps one discover the inward pain and also express it in mourning in a healthy way. It's an essential tool in accepting loss. So the emotion of sadness, I think from an evolutionary standpoint, is essential in allowing those around the bereaved to understand that something is not right. That's what our tears do. That's how our frown on our faces appear. They illustrate something isn't right to others within the group to come and investigate what is going on in itself. So moving on from Elizabeth Kubler-Ross, we look at other types of stages that have been analyzed. And William Worden has his various tasks of mourning. And he considers these tasks to be crucial in processing and healing through the grieving process itself. Now, again, in what order? Who knows? But these seem like pretty concrete markers in where an individual is or how quick they get there. Warden points out that one first needs to accept the reality of the loss, and that's probably one of the hardest things to do. If you notice, Kubler-Ross mentions numerous times denial and anger, and those emotions can sometimes prevent, that affective element can prevent the cognitive element from finally accepting it. The second phase is processing the pain of loss, which is the longest. The third is adjusting to the world without the deceased. And this is through hard and long grief work. Again, we come back to that concept of grief work. And finally, Warden points out that we need to remember the deceased through commemoration, but while still embarking on the future itself. So we still should be able to say, this is what I'm going to do with my life now, while still being sad. But you're maintaining that bond. You're continuing that bond while you embark on the future. And that's what our loved ones want us to do if they're no longer with us. Wolfelt mentions 6 needs of the mourning in this type of stage process in itself. He mentions that, again, similar to Warden, we find these common themes. As a matter of fact, in a lot of these lists in grief theory, you'll find very common denominators with a simple twist or a rewording according to the particular expert in the field, their own little nuance that they saw through their many, many hours of working with the bereaved and in their intense research. So acknowledging the reality of death, embracing the pain of the loss, remembering the person who died. And in many ways, this is commemoration. Developing a new self-identity. Many times our identity is tied to who we lost. So individuals will see themselves as husband, wife, son, father, or maybe it's a job and now they're retired. Or maybe they were an athlete and they had a bad injury. So it's important to develop a new self-identity as we move forward. The fifth is searching for meaning, finding meaning. Meaning is the anchor in the ocean of life. The currents push us, and if bad things happen, we're going to drift with the currents to who knows where. Meaning is able to anchor us beyond these changes and keep us in one place and to interpret all of these events that occur with a particular meaning. And we're not here to preach one meaning over another. It's the meaning that anchors you that is important. And finally, let others help now and always. We can't just close ourselves up in loss. Instead, we need to move forward and allow others to help. And in some ways, help others. And I think a lot of individuals are able to remember the person who died by commemorating that and helping others understand the process without overemphasizing your way, but sharing your way to see what resembles this particular person's own grief journey. Therese Rando has some steps to follow as well. She's another expert in the grieving field. Rando emphasized the 3 phases of loss. She pointed out that the phases of avoidance to the loss itself, so that's phase 1, leaving avoidance, the eventual confrontation to the loss, meaning facing it, and then the accommodation to the loss itself, which means adjusting to the loss. So let's take a little bit closer look on this slide to what Therese Rando is looking at. Leaving the avoidance phase. That means we recognize the loss. And this again seems to be universal in all grief theory. Confronting the loss. This means reacting to the separation in the present, but also to the various secondary losses that are associated with it. Therese Rondeau then points out that we need to recollect and re-experience the pain and feelings that came with that loss. We can't hide them. We cannot simply sweep them under the rug, but we must experience them. And sometimes it's more than one experience. It's through death dates. Finally, within this second phase, she talks about relinquishing old attachments and old assumptions about the pre-loss world. So within the pre-loss world, we had different life. We had a different daily schedule. We had different ideas about what life was. However, death and loss changes, and that's part of the process. So how are we able to let go of some of these older attachments, not severing them, as Freud would contend, but finding new ways to interpret old assumptions? And this is where we come to accommodating the loss. What I just said, readjusting to the new world without forgetting. And finally, reinvesting energy into new relationships, causes, hopes, and activities. And this can be really difficult for some. Reinvesting energy into new relationships, new individuals that aren't the other person, or causes or hopes or activities, and finding joy in those activities, or proceeding forward. Maybe in your life, you lost someone and you were working on an education track or a professional goal. Continuing that after the person has passed is sometimes hard to do, but ultimately it can become made in honor of that person by continuing to live, because that's what the deceased wants us to do, wants us to continue to live. Now, leaving these types of stage theories, let's take a look at the important role attachment theory plays in the grieving process. John Bowlby did a lot of research on attachment. Bowlby worked with infants, toddlers, and children who are unable to secure bonds with a primary caregiver. He studied how this affected not only healthy attachments, which are what we refer to as secure attachments, but also how it affected grief itself. So individuals in life will, with secure attachments, grow into secure individuals with their relationships and their attachments with others. Everyone still will experience grief to some extent, but secure attachments are usually more able, not necessarily all the time, but they're more able to go through a more healthy grieving process in itself. So within these studies, what Bowlby pointed out with attachment is when attachment is taken, when the bond is broken, we can use that synonymous word as well, there is a numbing and denial of the loss of the bereaved. There is a yearning and searching for that attachment. And through that yearning and searching, we see a disorganization and despair phase, which again is common with many of the other stage theories we looked at. And then finally, there's a reorganization that works around the change event, the loss event, to reorganize one's life. Now, when bonds are not secure as a child, where parents didn't take care of their children with love and affection, where children were left alone for hours on end or abused, this can lead to issues in attachment and grieving later in life, where we see insecure attachments that are anxious in their very nature or avoidant in their very nature. And an anxious individual will grieve differently more than an avoidant individual who might be more less inclined to express grief or share what they're feeling. The third grief theory we looked at was dual processing, and that was through Margaret Strobe and Henk Schutt. And process in this is important because it emphasizes that we grieve on two fronts. We grieve first on the loss orientated itself, which is a process dealing with the loss, and then a restoration orientated process where we look to re-enter the world around us. So one is internal, one is external. The loss orientated process involves the primary loss. Internally, one must grieve the loss and absence of the deceased or whatever the loss may have been. Loss of a job, or maybe a loss involving one's certain abilities, a loss of a limb, or a loss of one's past abilities. It might be one's health or so forth. Now, the restoration orientated process happens simultaneous. We're not just able to sit down and grieve and have the world hit the pause button. Unfortunately, the world continues to move while we're grieving. So within this, we have to encompass the various multiple secondary losses that we have to confront while grieving. This involves funeral arrangements, returning to work and being grieving while working, adjusting to home life without the deceased, and then the new roles that accompany that: cooking, laundry, and paying the bills. These roles can suddenly become overbearing, especially if one had a wife who did the traditional cooking and laundry, or if you had a husband who did the traditional lawn work. It might just be too much. In addition, new relationships may emerge, replacing older relationships that no longer exist. Many times, a wife who lost a spouse might not hang out as much with the couples that were friends with the husband, or vice versa. Also, stressors of maintaining existing relationships can emerge. Individuals might start throwing around blame or anger at others, and it might be harder to maintain these particular relationships. Also, within these secondary losses, the person may also start to face issues regarding their identity. If a parent loses a child, the feeling of no longer being a mother or father may exist. We briefly discussed this earlier. Or if someone loses a long-term career, the person may feel as if he or she is no longer a doctor, a serviceman, or a police officer, or a firefighter. So these things that we identify as losses can take away from, and we might have a hard process within the restoration orientated part of understanding who we are. We're now going to enter into part 3, types of grief. And in this part, we're going to go over a variety of types of grief that individuals can experience. The first page, the first clip we have here, first slide, merely is outlining the types that we will spend a little bit more time in within this particular segment. Normal grief and complicated grief. Grief remains normal when it stays within the healthy trajectory of cultural traditions and basic grieving cycles. However, it can quickly become what we refer to in the field as complicated grief. This occurs when it fails to adjust and move beyond the basic forces of loss. It then becomes pathological. So we can have many issues of unresolved grief, where grief work is not accomplished. This can lead to delayed grief, which later manifests. It can lead to masked grief, where the individual is not exhibiting the grieving patterns or avoiding them. It can be ambiguous grief, where there is no resolution to the loss itself. We'll talk about that. And it can also be exaggerated grief, where it's intensified. And in these cases, we look at what we refer to as prolonged grief disorder, which is a pathological, acute reaction to grief that persists well beyond the normal trajectories, but not just in time, but also in terms of inability to adjust socially or internally, effectively, cognitively, and so forth. A few of the other types of grief include traumatic grief. It's a severe and disabling response to sudden, unexpected, or violent action. So it's not your normal type of loss. Traumatic grief leads to complications quite a few times within individuals, although it's still in the lower percentages, but it is enough to warrant concern, especially if an individual is being seen who has a traumatic experience. And within that grieving process, many times depression can be an end result of traumatic grief, as well as PTSD or prolonged grief disorder, as we mentioned above. So traumatic grief can heal. The human mind and psyche does have an ability to heal despite these horrible things. But in some cases, individuals have a traumatic grief reaction, which leads to pathology because of what was witnessed, what was experienced, what was lost is so horrible. Anticipatory grief is another one we'll look at, and this is a type of grief that begins before death or the loss occurs. So you're thinking about it in advance, and we'll talk here when we approach that topic about hospice and those who experience this type of grief knowing that they're terminally ill. And this refers to family members as well as the patient, him or herself. And this was something that was intensely studied by Elizabeth Kubler-Ross. Another type of grief is referred to as disenfranchised grief. We'll go into that in more detail. And this is when individuals are unable to express feelings or their loss in a way socially that normal other individuals can do. And their loss is considered or labeled as insignificant. So think pet loss, miscarriage, or relationships that were once considered taboo or hidden. So we will look at those types of loss when we approach that slide. And finally, we're going to look also at social or collective grief. And this is a grief that affects society as a whole. It could be a national loss, a tragedy, or even a soul wound within a particular race or culture that shares in a past loss that collectively affects the individual. Environmental grief can also fall into this category in terms of how it affects everyone. So let's take a look at some of these in a little bit more detail within this session of the presentation. Complicated grief, when grief goes wrong. So normal trajectories of grieving and readjustment sometimes becomes complicated and can cause prolonged grief, depression, delayed grief, mass grief, ambiguous grief, prolonged grief, exaggerated grief, and various complications that come with each and every type of one of these. Complicated grief hence can be super intense, ironically absent, lasting very long, and pervasive. I think that's important to point out. Pervasive in every aspect of the griever's life. There's no escape. 10 to 15% of the population can have a complication in grieving. Now, that might not seem like a lot, but consider this. Consider the fact that every human being grieves. So 10 to 15% of the population is the population of planet Earth, not just individuals who might experience something that no one else does. Grief is universal. So 10 to 15% of the population of over 6 or 8 billion people is a lot. Prolonged grief feels as if everything is missing, with also a loss of identity. While depression can be void of an object or reason, prolonged grief has an object, but it has the inability to adjust to that object, and it shatters the entirety of the human person. Things that can be signs or signals to potential complicated grief. Again, remember, only 10 to 15% of the population are going to experience this. So many individuals, they go through these things and they're able to work it out. But what are some factors that really highlight the potential for complications in the grieving? Relational factors to the deceased. What's the attachment? We talked about on one of the first slides the more severe types of loss in regards to a person. We talked about trauma, obviously, but we also talked about the types of individuals that we lose. Children, obviously, right up there. Parent, spouse, right up there. So the chances of a complication just with that alone is higher than a different type of loss. Dysfunctional relationships can play a role in complicating grief later. Estrangement or any types of other emotional battles that the individual had with the deceased before they died. Over-dependent individuals of the deceased who passed away. So imbalanced relationships, estranged relationships, these can all play roles in future potential complications. Circumstantial factors such as ambiguity, an unresolved loss of a person, or multiple losses at once are signs of potential complications later down the road. Lost children who are never found, missing soldiers who never return home, severe trauma and tragedies involving multiple losses at once can be circumstantial factors that give the therapist a little bit of insight of, I better keep a close eye on this particular client as they go through the grieving process. Personal factors also, such as the person's individual ability to cope the loss, the multiple secondary losses that this particular person is facing due to the loss, the individual's past grieving patterns, and their past mental health all play roles in how they are going to be able to conduct their grief work. Also, social factors come into play, such as the nature of the loss is stigmatic, such as the case of suicide. And suicide usually complicates grieving every single time. Negations of the loss by society due to disfranchising or lack of social support for the loss. No one is there to help the individual grieve. These are all factors that can also lead to potential complication of the grief itself. Now let's take a look at the trajectories of complicated grief. While some of these issues may manifest in a new and acute grief, which is normal after 6 months or so, if these symptoms linger or if reactions become more extreme, then one can assess a possible prolonged grief disorder and grief reaction. And these will portray what we refer to as the complication that is being seen. Cognitively, an individual might resist the idea that the person died. It could be a psychosis event occurring, or continued denial of the death or loss resulting in the behavior prevents continuing bonds. So how the loss occurred, it could be a denial, a psychosis, or it could be a certain behavior that is preventing continuing bonds. Blaming others for the loss is also a cognitive red flag. Affective red flags include increase in continued anxiety and depression. Some exhibit a lingering sense of foreboding. The anxiety is so high that they're afraid maybe something's going to happen to them as well. Spiritually, a lingering spiritual distress and despair. One has an inability to correlate the loss with one's belief and their meaning system. So again, their anchor, as we talked about earlier, their anchor is no longer there. Behaviorally, where there's a wide spectrum of behaviors that can associate with complicated grief: aggression, violence, impulsivity, risk-taking, harmful practices, maladaptive coping, which includes substance abuse, clinging to possessions, withdrawal from family, and increased dependency on others. So it can go multiple directions. It can go multiple extremes in these types of behavioral trajectories that we need to look at. Now, as we move on from complicated grief, let's look at traumatic loss, which is, again, 10 to 15% of the time tied to complications and probably a little bit higher than normal loss. And I don't want to minimize or disenfranchise anybody's loss, but let's look at why traumatic loss is so intense. Traumatic grief or loss can lead to PTSD, post-traumatic stress disorder, and other complications in grieving due to the severe nature of the loss. Human-caused trauma is more imprinting, by the way, than natural. So it can be a natural disaster, a series of tornadoes or hurricanes rip through, a devastating earthquake, traumatic loss everywhere. Or it can be human-caused, mass genocide, a war zone for a soldier, or an individual caught between the fire. It can also be due to witnessing a crime or being a victim of a crime, a very heinous crime. And this seeing the total depravity of human nature itself. So in these cases, human trauma always leaves a more horrible mark on the human being and the ability to process this. Robert Lifton listed a few key terms for survivors of traumatic loss. One of them is death imprint. And this imprint can lead to anxiety disorders as well as PTSD. So an individual who comes home from war has this image of death that sometimes isn't processed properly. Maybe someone who lives in an area where a disease hit hard, especially in third world countries, and they see death everywhere around the corner. This can lead a death imprint, especially on younger children. Death guilt is the second thing that Lifton brought up. And this is about individuals having survivor guilt. They go back and think, this is what I should have done or could have done, but didn't. Maybe they're feeling regret over a lack of courage in that singular event. And they feel cowardly and they need to process that because they might have done what they should have been. First responders sometimes think, well, if I would have done this or that, I could have saved the person. If I would have, instead of done this particular thing, I could have done this medical procedure. They start to second guess themselves and might feel a death guilt. Psychic numbing, Lifton pointed out. This refers to loss of emotional reaction to horrid events. So there are various ways in which individuals become numb to simply seeing it. Cops are a good example. They come home every evening to their family and they see some of the worst of the worst. Soldiers can come back and not respond to something that would normally make an individual cry or feel intense fear. This psychic numbing is something that needs to be processed. Suspicion of counterfeit nutrients. In this, it's a reluctance to find support. And also a denial of the event because the person feels so tainted or broken that they don't want to talk about the event, they don't want to be labeled to the event, and they don't want to find support because they don't think it's going to be able to help them. And a lot of individuals feel dirty. Unfortunately, a lot of victims of horrendous crimes such as rape feel dirty. And instead of seeking help, they feel as if they're the problem. And these are things that are associated with traumatic loss. Now, due to this, it is traumatic and it imprints on the brain. So when loss or trauma occur, complications in grieving as well as PTSD manifest. So one who is in what we refer to as acute crisis is overwhelmed and becomes emotionally imbalanced. This is a disequilibrium. Is sometimes so severe that one is unable to cope or properly store the memory. This leads again to this imbalance and inability to cope on the spot. So crisis professionals, whether they're on the scene or later in a short-term care facility working with an individual who is still in crisis, discusses these types of traumas and losses with the individual and helps them try to find equilibrium again and ability to cope. And once those two things are stabilized, it's almost like first aid. Crisis intervention specialists are on the scene, EMS. Then the individual, once stabilized, is able to be brought to long-term care, which is regular checkups through counseling. So there's a big difference between short-term crisis and then long-term care of that particular crisis, especially with trauma and PTSD. The amygdala itself, as we see on the other side of the slide, amygdala deals with emotion, and the hippocampus deals with the conscious memory of those emotional events. So when we're speaking of these types of traumas, whether naturally occurring or through the evil hands of humanity at times, the memory or the event is not properly processed within the frontal cortex. And the filing of the memory doesn't really find itself properly stored in the hippocampus. So the intense activation of neural transmitters in this event play a role. This is referred to as psychic trauma, and this leads to unresolved memories and long-term issues. And this is where professionals come into play, not at the moment of crisis, but the long-term care to help these individuals process this trauma, to help individuals process this PTSD. Now, PTSD and intense trauma can lead to a variety of issues such as disassociation, depersonalization, where the person experiences a state where one can actually see oneself from a distance, or when one enters into a state of derealization, which distorts images and reality around the person. And these can be horrible things that can occur, especially when one's driving a vehicle or in public and they have a social anxiety attack itself. And this is where therapies come into play to help understand the PTSD and the intense traumatic grief. In these therapies, individuals are taught how to respond to these incidents of dissociation through grounding, meditation, and other ways to deal with the immediate. There's also various exposure therapies, EMDR, which deals with the eye movement and being exposed to it, the memory, and being able to desensitize oneself to it, and then being able to go further down the road and to recalculate one's affective and cognitive responses to that event of the past in a more healthy way in the present. And this is all about restoring the trauma that has occurred in that. And that's a difficult and very long process in itself. Now, leaving trauma and traumatic loss, we now turn to ambiguous grief, which in itself has many complications. Ambiguous grief is a type of what we refer to as unresolved grief. One is not only mentally unable to resolve the loss, but also physically unable to resolve the loss due to the extending circumstances of what's occurring. Missing children, miscarriages, inabilities to conceive, POWs or soldiers that never come home, a pet that is never found. Ultimately, it all leads to the griever is unable to find a conclusion to the problem or the loss, but is constantly tormented with the thought of quote unquote, what if? So one is trapped between thinking the worst and not giving up hope. This leaves the griever in a constant state of anxiety and pain. So if, God forbid, there is a missing child, you can't just give up. You're hoping every day that that child is found or returned or not harmed. But at the same time, as years go by and the probability of it not occurring, one is tormented with the ambiguous grief of, well, if I give up, then I've given up on her or him. I got to remain strong. I got to keep going. No closure. So there has to be a balance somewhere of where reality and hope can coexist to some extent until closure is found. Unfortunately, in a lot of these stories, there is never closure. Whoever it is that is lost is never found. And individuals live in this ambiguity, this complication of grieving. Without classic rituals of healing of a funeral, this closure was not permitted. Unclaimed bodies from disasters, plane crashes, war, and tragic events can all lead to this type of ambiguous reaction. Now we're going to look at anticipatory grief, which is also a sad type of grief, except instead of no resolution, one is looking to what's going to happen, the closure that will eventually come. Pastoral care finds itself in this area more so, chaplains and so forth, those in the priesthood or ministry. And these individuals are dealing in the area of what we refer to as pastoral thanatology, coming from the Greek word thanos or death. And these individuals that need help are either terminally ill or awaiting to probably pass away, even though they want to keep hope. Again, there's that horrible, horrible choice, hope or death, and when to become realistic. So hospice nurses, chaplains, and other healthcare behavioral professionals are trained to help the grieving with dying. Uh, Unfortunately, many nurses in the healthcare side, doctors, lack adequate training in this field, according to Kessler. And Kessler is very much has a lot of insight into pastoral care. He's written numerous texts about uh, the challenges of healthcare and how many doctors lack a good bedside manner and how important this type of training is for those on the other side of behavioral health, but in physical health itself, medical health, hospitals, and so forth. So, anticipatory grief of death for both the terminally ill and family can cause problems, not in just terms of not being able to accept what's to occur, but also because one doesn't want to accept it at all, and they then put off important discussions. Uh, Keeping current relationships, speaking about the death as if it is taboo, resolving important issues of the terminally ill patient, whether it's financially or more emotional. These things end up being postponed. Living wills, they're postponed due to anticipatory grief because no one wants to face the fact that this person more than likely, unfortunately, is going to die, but everyone wants to keep praying. Everyone wants to remain hopeful, but no one wants to look at the elephant in the room. And this is one of the things that anticipatory grief takes away, not focusing on the present the way one should. So the terminally ill also face a lot during this, not just the family being afraid to discuss it, but the terminally ill sometimes want to discuss it, but yet everyone sidetracks them, whether it's the doctors or whether it's their family. No one wants to talk about it. And in some cases, they're left out of the decision-making process. Their dignity in listening because everyone's afraid to speak about the horrible thing that might occur in front of them. So the terminally ill need to have a reality presented to them, but also alternatives. Be involved in the treatment process to allow human dignity to manifest in where they're going, to have an understanding of the procedures, the pain management, also potentially the end of life procedures. So caregivers need to be involved in this, helping them have these positive options throughout the process. It's important during this for caregivers to treat the whole person with dignity. And many times, again, doctors who lack bedside manners, not all doctors, but some, they only focus on the body and they almost see the body. They see so many individuals, it was like a mechanic in a car. If they can't fix it, then it's a failure. But it's not always about fixing. It's about helping the person through the process, mind and spirit with body. So many caregivers and family members need to look at the whole person and help that person move forward with what's occurring. Many family members may also experience a delayed grief reaction because they didn't grieve during it, because as caregivers, they had to be up to date on medications, doctor's appointments, knowledge about what's going on. Others might experience the grief anticipatory, and when the death happens, they might feel a little bit of relief and they can feel guilty for that. And that's something to also look at in clients who are coming to counseling. They shouldn't feel guilty. There is a relief sometimes when you see someone suffering long term. It's ultimately important not to allow anticipatory grief to take away our goodbye and the important role of spiritual rituals to follow, because it is part of life. Death is part of life, and we treat death as such a taboo subject that we won't even discuss it when everyone's healthy for fear of it might happening by just saying its name. The angel of death isn't just going to come because we say his name, but we need to talk about it in a healthy way. It's far from morbid. And when we don't, future complications can arise in itself. Our final type of grief that we want to look at is disenfranchised grief and pet loss. Now, it's not just pets, obviously. Disenfranchised grief can be numerous things, but usually we think of the loss of a pet. Before we go into the pets, realize that many people face disenfranchised grief. Those in other relationships that might not be considered traditional. So you might have a homosexual couple, and at least 20 years ago, these individuals weren't welcome maybe at a funeral for their partner. Their grief was disenfranchised. Maybe someone who's more distant from the event but cared about an individual, a boyfriend or a girlfriend, they're seen as their grief doesn't matter. Only this particular individual's grief matters. So whenever we dismiss someone's grief and we don't validate it, that's what's occurring. Pet loss is at the front of this when it comes to this terminology because for many, a pet is just an animal, and for many individuals, they don't have respect for what an animal is. And this is an injustice. It really is. Uh, Animals and pets are a lot more, and for some people, they're everything. So, pet loss is dismissed by many who, if someone's grieving a loss of a cat, a dog, a horse, a fish, it can be anything. The term, it's only a pet, this is when we disenfranchise that. Pet loss is compared. Many times individuals will say, well, at least it wasn't your mother or father. But for many, that loss of a pet is equally painful, especially for children who may have this as their first experience of a loss. And this is in the case of maybe a goldfish. How many times do parents try to hide that and replace the goldfish, stealing from a child that ability to experience grief? But whatever type of pet it may be, pets hold intrinsic value. To some, pets are family, and we might not be animal lovers. I am. But if we aren't, it doesn't give us a right to demean or invalidate one's loss of a pet. The relationship is key to this individual, and the pet has intrinsic value. What type of attachment, what type of bond? Who knows? Maybe the pet was given to them by a loved one who passed away, or maybe they're companion animals, or maybe it's a person who had this puppy or kitten or horse their whole life and they've never had children, and this is their child. Many ways, pets love us far more than human beings can. Their love is unconditional. And when we lose that, that bond can be strong. That bond can be just as strong as any person. So it's important that there is support for this through counseling. And it's important that in that counseling, that loss is validated and the loss is later celebrated and commemorated in a way worthy of the loss. Now we're moving to part 4 for those of us continuing along. Bear in mind, if anyone needs to take a break from this presentation, you can. But I've divided it into parts for that purpose. Part 4, we're going to consider various factors in grieving from a cultural standpoint, from a gender standpoint, from sexuality, spirituality, lifespan, and age. We're going to see how these things play subjective roles within certain individuals and how they grieve themselves. Now, cultural considerations in grieving is the first thing I want to go over. I think there is a diversity in grief. Multicultural competencies are key, and these are considered standard for those trained in counseling and social work. Any of those in the behavioral science should be, or if not, will have a multicultural competency type course, whether it's in continuing education later or a college course itself. Cultural issues can affect grieving. African, Asian, Native, Latino, and Middle Eastern Americans all share unique faiths, histories, and collective traumas. Many share what we refer to as a collective soul wound that affects the grieving process. Now, what do I mean by soul wound? And this is something that's coming up more and more in grief studies. Soul wounds refer to a particular society or race or culture that had something bad happen collectively to them in the past, and it has affected them collectively in the future of where they are. Obviously, first come to mind are African Americans and the slave trade, and then the Reconstruction period. Another one that comes almost equally to mind are Native Americans, especially the Trail of Tears, which happened to the Seminole Indians, who were forced and relocated to where they needed to be. We can see that also in cases of extreme genocide within the Holocaust and Jewish communities. But there are genocides everywhere where there are soul wounds, where individuals face discrimination, whether they're Islamic, whether they're Christian, whether they're Jewish, or whether just due to their nationality itself, and they're being sought to be destroyed through cruel actions. And these cultural issues later manifest in a variety of things. So, how one grieves these things uh, depends a lot on the individual and how attached they are to their particular society. So there's a lot in that in multicultural courses that you can take to learn more. And I think it's something that all counselors need to be intensely aware of. Immigrants also suffer a lot of grief, believe it or not. The life of an immigrant and a refugee can have a variety of previous traumas from where they came from, and then new adjustments in the host country that range from a new life to cultural biases of the host population, and also continual issues of deportation that they might face, separation from their family, and so forth. Gender also plays a big role in grief, how social norms equate gender. Many gender roles try to dictate how grief is to be experienced, and this could be also culturally, not just gender. Some of these social and cultural norms can be damaging to the individual's identity and their grieving patterns. The most clear, and I think first example that jumps to anyone's mind is men do not cry for a loss. And that's the exact opposite, and it can be very damaging, forming various complications in the grieving process itself. Sexuality can also play a big role in one's ability to adjust to loss. Homosexuals can suffer discrimination during the loss of a partner's. Others who struggle with sexual orientation as well as gender identification can experience complicated grieving processes with their own internal struggles that they are facing. Now let's look at some spiritual considerations in grieving, and spirituality is very prominent in how one is able to grieve and how our reactions to the spiritual develop over the grief work determine if sometimes complications in the grieving process occur or not. Overall, we can say that spirituality and loss is a good thing. Spirituality and grieving can be any type of belief system that a person adheres to. We're not here to advocate one faith over another. It can even be a worldview or a philosophical anchor that explains the human condition. So it's not necessarily even spiritual. It could be a philosophical thing for someone who doesn't believe in God. Whatever it is, it's a meaning, an anchor that fits the individual's paradigm. However, when that loss occurs, that paradigm can be challenged. And when that paradigm is challenged, how strong is that anchor? And we've used that analogy before in this presentation. Spirituality and religion then play healthy roles in the grieving process. Overall, we said that spirituality and loss is a good thing. Ritual itself plays as a key role and a medicine in some ways to the dying and those in the loss process. Rituals can help individuals remain connected to the past, tied with the deceased, and also provide comfort. Spirituality also generates motivation and initiative. It helps one respond and be more resilient. As I said, it anchors one to a meaning in the pain. It grants one a sense of purpose to move forward. It gives one guidance in that loss, brings comfort, compassion, and promotes healing and change after that particular loss. However, many in acute grief can lash out against God, faith, or their worldviews. While some may not, there usually is a period of questioning, and that's healthy. It should be permitted, that expression of emotion or that cognitive thought that questions. I think counselors need to use discretion in responses to individuals who lash out against their faith. And we want to, at least in the initial phases, try to avoid theological explanations of loss until one is out of the emotional state of bereavement itself. In processing grief with our faith, I think these are some similar reactions that we see in no particular order: shock and awe, disbelief and denial. These are things that are common with the various stage theories. Lamentations. Lamentations are despair of the soul. So in this time, the person discerns and decides to move forward or not forward in their relationship with the higher power they believe in or the philosophy that they follow. If this process is shallow and not truly cognitively undertaken, then a weaker spiritual tie can result where it's no longer as strong. During this lamentation, there is a time of discernment where one may feel a call to conversion of faith with that loss. Following these deep inner workings of the soul, where there's a lot of dark thoughts, there's a lot of questioning, sometimes individuals reorganize and find a renewal of faith, and they become reconciled to that world meaning and the loss itself, and they're able to move forward in a healthy way. And then that results in the recovery, where one is again able to healthily express their faith after the loss itself. Those incapable of finding discernment during the lamentation phase never really find reorganization. They face multiple issues that can result in prolonged anger towards a God, a disorganization of their thoughts, and a despair until a new worldview can be adopted to give meaning. So sometimes they come out and they find a new anchor. They find a new way to translate how this loss has affected their actual faith. And some, unfortunately, may never, and they're constantly bitter towards a particular faith. And we see this in some clients. They'll be bitter against a certain religion because it is so associated with their loss, and they remain bitter at that interpretation of God according to that religion itself. And some may give up religion altogether. So spirituality can go wrong. While we see it as a general good thing, it still can create distorted thinking, instill negative emotions, and these things can lead to chaotic decisions. And we see a lot in religion, it's in the world itself, where when it goes fundamental, when it goes extreme, it can deviate and mutate from the original formula so much that it can cause a lot of problems. And in grief, this is nothing different. Misconceptions begin first with faith as contract instead of covenant. So faith seen as contract is, if I pray, I get. Covenant instead sees faith as relationship. If I pray, I'm still going to ask. If I don't get, I still know God is with me. That's covenant. God is walking with me through this loss. He still loves me. He's still with me. My faith strengthens me through this process. It's not a contract where I can redeem a coupon and get this or that. So those who have lower types of interpretation of what their faith is, their spirituality is not as strongly rooted, then many of those see faith as a contract. And when bad things come, that seed of faith is just going to be blown away with the wind. Others have a strong misunderstanding, especially those of faith as a contract, have a big misunderstanding with miracles. So when individuals misunderstand the nature of miracles and suffering, bad things can happen. You expect your relative to recover. You expect a miracle to occur. And when a miracle doesn't occur, you become angry at God, or one may become a feeling of unworthiness. Well, God should grant this miracle for me. I guess I'm not a good enough Christian, a good enough Jew, a good enough Muslim. Something is not right with me. And this is why God is not healing this individual. Instead of, again, seeing an act of covenant where God is with you through this. And if a miracle does occur, then it's a blessing. If not, God is still with me. So this does not in any way say that prayer is useless or one should not pray for miracles. It's just a matter of what one is expecting to get out of it and how they interpret miracles in terms of their faith and the potential loss itself. Emotions can go wrong. One can feel abandoned by God. They can feel guilty for reacting against God so negatively in the first day or two. They can feel unworthiness, as we mentioned, with miracles. They can have a permanent hatred towards God, or they can feel that they can never be forgiven for how they acted when they were in intense grief. So it's important as counselors to help guide individuals through these emotions and to present a loving God and a loving entity, whatever they believe in, that is not going to hold it against them or help the individuals who have hatred to God better understand what they're really angry about and how these negative emotions can be removed and help the individual find some sort of peace. Cognitively, maybe later in the grieving process, we look at the idea of theodicy, that God is either not omnipotent or he is not all good. So if the riddle so much goes, if God is not all powerful, then horrible things happen. And it's not God's fault because he's not all powerful. However, if God is all powerful, he must not be all good to allow these things to happen. And that's the play on words. And it comes down to more so not the fact that God is not all powerful, but misunderstanding what is all good and why God can be all good, but the world is not all good. And I think that comes down to really reanalyzing one's faith and understanding free will and understanding all the other things at play beyond the goodness of God himself. Social progress in grief. So in this segment, we're going to look at how aging and how we change can affect a particular grieving client. And I usually love to go over Erik Erikson and his 8 stages of development because they're so important for social psychology. But also, I think these present a roadmap in certain points in our development that are crucial. And if certain things are not developed socially, since we're social creatures, then how we react to loss can also be affected by where we are on these stages of development. And it just goes back also to John Bowlby and attachment. If we don't develop socially properly, in a healthy way, then we're going to have greater problems when things go awry. And in most cases, that's loss and grief. So Erickson listed 8 stages of development that are important. From infancy to 1 year, an individual should learn trust versus mistrust. And that's where John Bowlby points out proper attachment to the caregiver. We learn trust by being loved. Autonomy versus doubt, 1 to 3. This is when the child starts to explore. Does he learn autonomy, or is he over nurtured to a point of over dependency? 3 to 6, we see initiative versus guilt, where a child will try to do new things. Or is he scolded, or she scolded and felt guilty for trying to do new and exciting things? Competence versus inferiority. This is between 6 to puberty, where the child learns to be able to do various tasks and form some sort of healthy self-esteem. And in cases of they're not able to fulfill certain duties that a child should know how to do on their own, and they start to develop inferiority complexes. Identity versus role confusion is from teen into 20s, and it's during those ages, especially during the teenage years, it's the most difficult, where everyone has dealt with peer pressure and all the changes in the body. And it's sometimes hard to form a strong identity and anchor during that age. So there's a lot of waves pushing the person back and forth, swaying the person. So finding identity is important when you come out of this part of one's life, in regards to not being confused and knowing a little bit what you want to do. From 20s to 40s, we see intimacy versus isolation, where individuals are able to form healthy relationships or they isolate. And this has a lot to do with attachment disorders. From one's 40s to 60s, there's generativity versus stagnation. And this is equivalent to a midlife crisis. Did you do a lot with your life so far, or have you done nothing? And this can result in major anxiety. And integrity versus despair in late life. Did you live your life the way you wanted, in a good way, or did you drop the ball, so to speak? So we can see how these stages and ages affect current losses. So if you have a client within a certain age, what's their case history? Study their case history. See the stages of trust, mistrust, autonomy versus doubt, etc., etc. Look into their teen years with identity and role confusion and what might be causing that. See why an individual is having a hard time forming a relationship. See why a person is grieving particular things in their midlife. So these things are important to consider because they are the case history of the individual. And individuals who do not have the necessary stage development are going to have problems because they don't have the necessary social skills to face the particular loss. So this involves a little bit of homework on part of the counselor in understanding their client's case history to understand why this grief is affecting them this particular way. And our conclusion of age considerations, children themselves have their own way of grieving, and this in itself could be a presentation, and it might be in the future. But for now, it's important just to look at some of these headings that are important if dealing with the children. And most of you who are counselors, if you deal with children, you have special certifications and specialties, maybe at the college level, in child and adolescent psych to help you. So it's important to remember that children and adolescents learn grieving behaviors from us. They mimic us. They can develop good grieving patterns by how we grieve collectively. So child grief is unique. Children, depending on their development, which can range anywhere from a year all the way to 18, can grieve differently than adults in different ways. Different age groups have different responses and different reactions. Ages vary on understanding the permanence of death, as the point of if a goldfish dies, it can't come back to life. This is permanence. Some ages do not understand permanence. Other behaviors include regression. So if a death or a loss occurs, a child will regress in their physical abilities. Some might act out, others might withdraw, and those in their teenagers might even go into more maladaptive coping that parents need to be aware from. One of the biggest misconceptions is that children should be shielded from grief. Instead, children should not be shielded from grief. Children need to be exposed to loss and permitted to grieve here's the key, according to their maturity. In many cases, a child should be permitted to attend a funeral and be able to express loss itself. And classic example, if a goldfish passes, don't try to hide it and replace the goldfish overnight. Parents instead should talk about what happened, make it a teaching moment, and allow the child to commemorate the loss, maybe through a funeral or something, which will help develop the children's ability to socially understand grief and loss as the child ages. So loss needs to be discussed. Children need to discuss grief to avoid magical thinking in younger children. And magical thinking is something that involves if the child was angry at dad or a friend, and later that friend gets into an accident, the child, many times with magical thinking, thinks they caused it. So it's important to help avoid magical thinking by discussing grief. You don't know what's going on inside the child's head. And this will help expose guilt or also imposed role obligations that a child might feel they need to take. Maybe a younger teen might think they have to now be the breadwinner if dad is no longer there. Also, talking about the loss reduces future problems. A family that grieves together stays together. I kind of like that play on words instead of praying, which is still important, but grieving. And I think we underestimate the power of grieving together as a family unit and how powerful that is as a coping mechanism for support. Also, it's important to realize that children express loss in play. Children grieve at different intervals than adults. Sometimes during play, they express pain and loss. Also, artistic therapies and counseling are recommended. And again, this is so simplified in regards to a slide for a topic that can be its own presentation in itself. For those of us continuing along and not taking a break yet, part 5, helping the bereaved. And this will be the final segment of our presentation. And we're going to look at basic grief trajectory management. We're going to look at sojourning and the first steps of helping. We're going to talk about causing less harm. We're going to talk about grief treatments. And we're finally going to talk about resiliency and finding a future. So this is meant more so for counselors, social workers, and others. But if you are here just as an individual who is grieving, understanding how grief works and how to treat grief, you can sometimes self-medicate on the side and know where you're going to have a better understanding of what you have. And I think a lot of individuals who have maybe an illness, they like to know what's wrong. Obviously, grief isn't an illness, but it is a condition that we have to deal with. So knowing the medicine, knowing the things that we have to do to find ourselves again is important. So basic management of grief involves grief care of the physical, the cognitive, the affective, and behavioral aspects of a person while monitoring them. And in the beginning of this lecture and presentation, we did discuss about the manifestations that are found in the physical, cognitive, affective, and behavioral parts of a person. It involves in this management identifying the loss or losses, the impact on the individual, the grieving stage the client has experienced, the changes the client has made, and where the client is heading. It's also important to identify secondary losses that matter to the client. Other considerations are behaviors that are tied to healthy clinging of possessions versus unhealthy. So some individuals might cling to a possession and turn the room into a memorial where almost a mausoleum, not a memorial, where clothes are never touched after years upon years and nothing is ever gone through. So what's unhealthy there can be healthy in the acute phase where someone just wants to hold an object that belonged to that person or to properly look at it. So we need to identify behaviors that are healthy versus unhealthy. Other individuals might need reassurances of forgetting the person's face, or their voice. We also need to be able to help them maintain continuing bonds that are healthy as opposed to unhealthy. Beyond acknowledging the loss, a counselor can also utilize various ways to help one adjust and deal with the feelings that someone is experiencing. This includes self-management, identifying support, relationships, and beliefs that are helpful, reading of psychoeducation material and literature that might help the person understand grief more, understanding in this psychoeducation the process of time with loss and what to expect, the use of rituals within one's faith, values, and ceremonies, and finally, lots and lots and lots of talk. So counselors want to help the person find meaning in this loss and help the person grow around the grief. Obviously, we're not looking to fix or cure or remove the grief in itself. So within the first steps in helping, I think we need to avoid pithy sayings. One can help healing through empathetic listening skills instead, acknowledgement, support, and respect of the grieving process. So to acknowledge the loss and the pain, we need to use real statements. I am sorry for the loss is an excellent way to start. Or I cannot even imagine the pain you are feeling. How can I help? These are two great ways to validate, acknowledge, not try to disenfranchise, to show empathy, and also to show support. Asking what the person needs and helping them, also meeting those needs, is important because many individuals are afraid of grief and avoid discussing it. So sometimes it's up to you, the counselor, to initiate the actual conversation itself. Because individuals are touched by it, they're really scared to talk about it. They're scared to engage. So it is important, I think, sometimes to broach the subject. Surprisingly, I think we all will learn, most bereaved want to talk about the loss, and they do need a listening ear. They do need that comfort of silence and the listening ear that can heal sometimes far more than words. But unfortunately, after the funeral, many of these individuals do not have a soundboard. They don't have someone to listen. And this is the biggest thing in healing, that empathetic healing, that empathetic listening, that acknowledgement of the individual. So counselors can help the bereaved by normalizing the grieving process, by listening, avoiding judgment, helping identify needs, and when necessary, sending someone to a different level of aid if the situation itself falls beyond the scope of our particular training itself. So sojourning, I think, is an important term. We're not just counseling, trying to fix or cure, but we're sojourning with the bereaved. It's a vocation. So working with the bereaved involves basic counseling that looks at these things, but we're also going to want to more than merely observe, but walk with the grieving person. And that's what sojourning is. Sojourning is understanding that we cannot take away the grief, but we can help individuals live with it. And that is key. What we can look at while sojourning with an individual is the emotion of anger, how powerful anger can be, but how important it is in the grieving process. We as counselors can help guide it so that it manifests in healthy ways and direct it where it needs to be. Anger in therapy is a way for an individual to release pain itself and should not be negated. Also, remorse and guilt are also intense emotions that are experienced while sojourning with the bereaved. The bereaved may feel they failed the deceased or wish they had done something different. The finality and inability to change the outcome can intensify it. So here again, we are empathetically listening and helping. The deep emotion of shock and acute grief flows through the entirety of the person. The state of darkness and disbelief during the acute phase of grief is intense. Some may go into denial, intense pain, or emotional numbness. So, as counselors, we need to be aware of these potentialities throughout the grieving process, whether we're still in a normal grieving trajectory in which these things can occur, or if we begin to go on a complicated trajectory, in which case we would require, if you're not already, a clinical counselor to take over. With sojourning, the counselor needs to be present in the moment. I think that's key, but not intruding. So being present involves empathetic listening, but it also involves no judgment. It doesn't involve interrupting. It doesn't involve lack of lack of caring through how we look. So if we're with an individual, are we facing them? Are our eyes intently upon them? Or do we seem disinterested or indifferent to what's going on? So it's important then to not only be in the moment, but also present ourselves. Present ourselves as being gentle in tone, validifying emotion, and discussing when necessary anything that's spiritual to the person and helping that person grow around their grief. Unfortunately, I would hope many counselors are already well trained in this, but for those of you that are merely listeners to this presentation as fellow grievers, many times more harm can be caused to the griever by the way well-intentioned and untrained individuals look to help others. Many do not know how to handle grief themselves, and they promote their own ideas upon the griever. Many of these utilize various cliches, such as, she is in a better place. Or another one, God has another angel. And we've heard that before. Or it was God's will. Or I know what you're going through. Or at least ... So we see the effect to try to make you feel better, to take away your grief, but none of these things are really taking away grief. If anything, it's making you angry at God, maybe, or it's minimizing, or it's disenfranchising, or it's belittling in some ways. And it's not always the intention of these individuals. On a more harmful level, individuals who don't have the support systems they need come into contact with what we refer to as grief bullies. And this is a newer term to describe individuals who push their own style of grieving on others. And I do believe I mentioned them earlier in this presentation. Many times they themselves are having a hard time grieving or inherited bad grieving habits themselves. Sometimes a grief bully could be a mutual griever as well, not just an observer. Maybe this grief bully is sharing the common loss with you and they cast blame on you or pain on others. So this is causing more harm with their own bad grieving habits they might have inherited from their own family structure itself. Some ways that grief bullies can attempt to manipulate us and control us and belittle us. Some might say, we are not going to cry over this anymore, as if they have authority to tell you you can't cry. They want to control it because they themselves have issues. Or maybe someone will say, it's time you got over them. Or it's your fault she's gone. Or in suicide, you drove them to this. Another one might say, we're no longer discussing her death. Or in a disfranchisement type way, it was just a dog. So these types of statements are attempt to belittle your feelings, to make you adjust to a certain way that makes them more comfortable. And these are things that counselors need to point out for maybe individuals to be aware of and how to interpret them better in their own grieving trajectory itself. Now, there are a variety of treatments and therapies for grief. Many are cognitive, affective, spiritual, and behavioral. Some are a combination of all of them. So, in this slide, I want to look at a few of these for those who do grief counseling or want to do grief counseling. At a pastoral level, clinical level, depends. Obviously, some of these therapies deal with complicated grief. And because they deal with complicated grief, then only a licensed clinical professional can utilize it. As a pastoral counselor, we might be able to use parts of it, but once we, as a pastoral counselor, discover, because we're non-clinical, once you would discover that there is a pathology, you would refer. And that's one of the things that we looked at earlier in helping, understanding your limits. And that's important. So let's look at these. Narrative therapy. Narrative therapy is something that everyone does. It's discussing the loss. So it can be used for pathology as well as non-pathological grief itself. Meaning making and Robert Neymeyer, we discussed him earlier, making sense of the loss. This can be done in pastoral as well as clinical therapies. Meta reconstruction, connecting the past with the present and building a bridge to the future. Meta reconstruction looks at grief almost as a story of one's life. Throughout life, there's good chapters and bad chapters, right? We might have a chapter that we might want to forget, but it made us who we are. So, chapters where there is death and loss are individual chapters, but there are present chapters which might also, at the moment, have a death or a loss, or they might be ones that are reflecting on the past loss. Regardless, these chapters in our life, the book of us, the book of you, these chapters build up to the future itself, future chapters. And once the final chapter is finished, the book is closed. But everything that made us who we are, the good, the bad, the pretty, and the ugly, are all in this book. And they all were important in helping us build in who we are. And if we understand loss and grief as part of life, and we're able to connect our identity of who we were then, who we are now, and who we will be with loss, then we can move forward. And that's basically what meta reconstruction is. Other therapies involve problem-solving therapy. It focuses more on secondary losses. It's very orientated on finding solutions, short-term, long-term. Stress reduction therapy, which looks at numerous ways to reduce stress that is associated with grief, and merely look at various forms of breathing, reflection, meditation, other holistic methods. Expressive therapies involve art, music, journaling, and poetry. Again, this can be at the pastoral or the clinical levels. It's usually very important for children to utilize art, as we spoke of, but I don't think it's something that necessarily should be dismissed for adults, especially with journaling. The ability to write our thoughts on paper are very powerful in terms of helping us understand. Sometimes just seeing it written can help, but it also leaves a log where we can return and see how we felt 2 weeks ago, 1 month ago, a year ago, and then compare. Obviously, music and poetry also can lift our souls. It's one of the most beautiful things about being a sentient being. It takes us beyond this temporal realm and is really a taste of heaven. Music and poetry, how it can put our feelings to movement within our very soul and help us find meaning in itself. So expressive therapies are something that are commonly utilized. Cognitive behavioral therapy, originated by Aaron Beck, focuses on reorganizing and assessing thoughts that we may have to change behavioral reactions. And this is more at the clinical level. So if someone has a negative ideal about something and this is affecting their behavior, cognitive behavior therapy goes back and tries to analyze why one is feeling a particular way and then how to move forward from that. Psychodynamic therapies are more Freudian in general, but they're still equally useful. They focus on internal patterns and process of individuals' past. So, how we are inside, how we developed through our younger life, and how our past dictates a lot how we grieve today. So, we look back and understand our past grieving experiences and how we have formed certain relationships and determining how we will face grief in the present itself. Rogerian therapy, originated by Carl Roger, is a more humanistic therapy, and that looks at unconditional acceptance by the counselor, genuineness, empathy, and other ways of just being there. And again, what I mentioned earlier, sojourning, walking with an individual through grief itself. It looks to meet the basic needs of a human from Abraham Maslow's hierarchy of needs. It looks at what does someone need and how can I listen and how can I help that person feel better emotionally and help them go forward, pushing into new ways of understanding life. Medicative treatment sometimes is a requirement as well. Usually medicative treatment is used in correspondence with behavioral counseling. It looks to rebalance serotonin through various selective serotonin reuptake inhibitors. The treatments can be short term, moderate, or longer term, depending on the situation. So we normally see these things dealing with anxiety as well as depression. But in extreme cases of acute grief, sometimes short term or moderate can help an individual work through, and through a psychiatrist or a medical doctor can be prescribed and utilized in a safe way to help the individual at a neurotransmitter level be able to deal with the grief and to focus and to adjust in a safer way. So medicative treatment isn't necessarily a bad thing. I think sometimes individuals try to self-medicate with herbs and stuff without discussing this with their primary provider or counselor. Anything that one is taking should be reviewed because some things can counteract with others. And then various treatment amounts should only be prescribed by medical professionals who've studied and have done the research and have worked with countless of other patients in the past to ensure that it's safe. And also due to the fact that there can be withdrawal symptoms, to have the ability to utilize these medications in a safe way. So if you're feeling sad yourself, do not self-medicate. Instead, contact your professional, medical provider, primary caregiver, or your counselor, and let them know that you have these feelings and you feel like you're a good candidate to be put on certain medication to help you temporarily through this. Now, there are other types of therapies that are more innovative that are coming out, various exposure therapies, EMDR we spoke about earlier. These things can also be utilized by clinical professionals who are certified in these special other types of treatments. So don't just limit yourself to the basics. See what your healthcare provider or behavioral health provider can supply, what they're capable of supplying, or who they might recommend. I think it's important for also counselors to understand if you belong to one particular school of thought that's listed here, might not necessarily be good for one individual, might be great for one, but not good for the other. Maybe there's a combination of Rogerian and cognitive, maybe some psychodynamic. Who knows? Point is, don't be rigid in your approach. Have a full menu of various ways to help individuals through grief and through that process itself. In doing so, the key is to foster resiliency in grief. Resiliency is tied to the ability to nurture oneself physically, affectively, cognitively, socially, and spiritually. All things that we have discussed and how important it is. Positive psychology helps foster this optimism. It helps encompass hope, confidence in the client, and cheerfulness. We need to help clients identify resources through grief, support systems, and to identify their own internal strengths. Sometimes it's also good to go back to that cultural topic we covered. Identify cultural pride and identity of self. And this helps clients develop meaning in their resiliency itself. Identify for them positive activities that they can do in regards to healing or other various therapeutic life strategies via exercise, nutrition, a social life, proper sleep, utilization of meditation and religion. And we also want to be a life coach in this regard. We want to help develop plans to overcome challenges that might come up during this grieving process and to set realistic, reachable goals to show improvement and self-accomplishment, which builds self-esteem and resiliency through the grieving process. Again, ultimately, the goal is not to cure a person of grief, but to help a person grow around that grief and to become stronger in that. So grief counseling, if we haven't learned anything from these 5 segments, is important. Grief is universal and part of life, influencing all fields, behavioral fields, clinical counselors, clinical helpers, social workers, school counselors, educators, psychologists, and psychiatrists all help individuals in grief. But this is not limited to what we would refer to as human services. It's also in the healthcare fields. Doctors, nurses, hospice nurses, palliative care professionals all deal with those in grief. And they need to have a better, appropriate grieving language that they can better articulate. Those in the pastoral fields deal with grief consistently. Clergy, priests, ministers, chaplains in the military and hospice, as well as funeral directors, need to be able to help others who are grieving just due to their very position. And those in the emergency fields or first responders, police, fire, EMT, those trained in crisis intervention, tier 1 operators on phone lines, they all need to also be well trained in grief counseling. Some operate in human service at a clinical aspect. And clinical just simply means one who is licensed, one who is able to diagnose, one who is able to treat, one who is able to possibly, if a psychiatrist or an MD, prescribe. While others in the grief counseling field are non-clinical or pastoral. And they obviously cannot diagnose or claim to be a licensed counselor or social worker, but they are able to help individuals at the basic grieving level because grief is not a pathology. There's no licensure in grief counseling. These individuals help individuals through grief counseling at the most basic level through the most basic trajectories. And through those trajectories, guide individuals to a healthy adjustment to the grieving process, ensuring that grief work is fulfilled. So there's various elements to grief counseling to everyone themselves. Now, I would like to give special thanks for this ability to do this presentation today. I'd like to give special thanks to Thrive Counseling, who was generous enough to donate a lot of their time to allow me to review from direct and indirect areas how the agency operates, as well as working with individuals who have experienced trauma and grief and sitting side by side with licensed counselors. I myself, while I have an MA and an MS and a future PhD, hopefully in counseling, am not clinical. I'm more on the educational side. And that's where my connection with the American Academy of Grief Counseling comes into play. The American Academy of Grief Counseling is an organization under AIHCP, a segment under AIHCP, I should say, that deals with certifying individuals who are looking to become grief counselors. And we certify clinical as well as non-clinical members who are looking to become certified. And again, certified members can work with individuals who are experiencing normal grief trajectory as well as complicated grief trajectory. So if you ever have time, if you're a professional and you're interested in becoming certified with the American Academy of Grief Counseling, please check us out, www.aihcp.net. Again, that's www.aihcp.net. And our phone number is 330-652-7676. Again, that's 330-652-7776. Our email is info@aihcp.org. Again, that's info@aihcp.org. For those who just watch, though, for training purposes, or those of you that are sojourning with us through the grieving process, I'd like to thank you for listening throughout this long presentation, whether you went through a variety of the segments or you went through all at once. I thank you for taking the time to learn more about the grieving process that you might be going through, or the grieving process, and better training yourself to help others. This last slide is our reference slide. So throughout this, there were enormous amounts of references, APA style, throughout the presentation. And here is the long list. Some of them are primary sources, some are secondary sources, some are textbooks, there might be a few articles as well. A lot of the information found in these texts were pivotal to highlighting a lot of the concepts that we went through from part 1 through part 5. So if you have any inclination to utilize any of these wonderful resources, hit pause and take a look at them. I think they're very useful for some. Also, I want to give credit where credit is due for many of the thoughts and concepts that I went throughout this session, and to give the proper intellectual acknowledgement of these individuals and their important part in grief theory itself. I would like to thank you for listening again. It was a long presentation. If you went through merely various phases of it, or you went straight through, I congratulate you. And also, please do remember the American Academy of Grief Counseling and its certification process for non-clinical as well as clinical counselors. I'd like to thank you for listening again, and have a good day.